What's causing my drooping eyelid? I've read a lot about ptosis, but I'm wondering if there's any way this may be allergy related. It is worse, as in photo, when my allergies are bad, also bad in the morning. Is there any non-surgical way to at least improve it? I'm only 30 and would rather put off any procedures until they are both looking a little saggy. My father's side of the family gets a hooded eye, kind of different than my current problem, as they age, and I suspect I will want to get them both done eventually.
Thank you for your question. You're asking about what's causing your drooping eyelid, and you state in your question that you've learned a lot about ptosis, but you're also asking about whether or not this could be possibly allergy related, and you've submitted a photo to help me guide you. So, just a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. As an oculofacial plastic surgeon and in practice for over 20 years in Manhattan and Long Island, I have focused almost exclusively on cosmetic and reconstructive issues of the area, the eyelids and face, as well as complex revision surgeries and the many different artistic ways to approach enhancing eyes. So this is a type of issue that I deal with in my practice every day. So I think that it's very good that you have pursued knowledge in this area and you're familiar with the term ptosis. But to help guide someone like yourself who comes to my office, I also want to help you learn a little bit about definitions and how it applies and and how it would be relevant to your situation. So one of the first things I help people understand is a drooping eyelid can be caused by something called dermatochalasis, which means excess skin or redundant skin. And that is what I think is more consistent with what it appears to be the case on your right upper eyelid, where it looks like the skin is hooded over and approaching the eyelash. Now that is to be distinguished from a term called ptosis. Ptosis it describes the relative position, which means, of course, ptosis meaning low, to the eyelid margin relative to the pupil. And so when you look at your eyes, it looks like the eyelid margin relative to the pupil is pretty symmetric. But what you're dealing with is an asymmetry in the relative hooding of your eyes. Now there are a variety of reasons for this type of situation. Sometimes when the skin is asymmetric just from relative stretching of the skin, whether the shape of the orbit is a little bit different, and the orbit being the bones around the eye, as well as the relative amount of fat around the eyes, it is very common to have this type of situation. Now, as far as doing something surgical is concerned, I can tell you that in practice for over 20 years, I've operated on many people your age who had exactly this issue. And the reason that that's the case is that essentially, if your goal is to achieve a certain amount of symmetry, well, you have a couple of different options. One approach would be to add volume on the left upper eyelid in the sub-brow area to try to make it look more full to match the right eye, or to do a subtractive procedure where you take away extra skin and fat on the right eye as well as maybe some on the left eye to create better symmetry. So I don't think you have to necessarily adhere to a rule of delaying surgery if surgery is the best solution. There was a time where surgery, it was more justifiable to delay surgery because people would not want to go under general anesthesia and put themselves under additional physical stress and go through hospitalization. In my practice, we do everything under local anesthesia with light sedation. This includes eyelids and facelifts, cheek implants, and even body procedures like liposuction and breast augmentation we do under local anesthesia with light sedation. That means you don't have to go under general anesthesia. We put a small intravenous and just give you a little liquid, equivalent of like liquid Valium. So I think that the terminology is important to understand, but practically speaking, you need to meet with a doctor who has a lot of experience with eyelid surgery to help you understand what your options are. It is sometimes eyelid surgery is oversimplified, and people will do something and regret having done it. As a specialist, I do a lot of revision surgery, and I've seen that scenario. So I spend a lot of time with my patients and try to help them understand what their options are, and then help them make an informed decision. So as I said, surgery may be an option for you. Fillers may be an option for you. Maybe some type of balance is also possible between those two options. But ultimately, a proper examination and consultation is necessary to get a real three-dimensional sense of what is appropriate. So I hope that was helpful. I wish you the best of luck. Thank you for your question.